Hi, and welcome to Hard Questions with Hightower Men's Clinic, the place where men confront the decisions they've been avoiding about their health and their performance in and out of the bedroom. No filters and no distractions, uncut. And we're getting straight to what actually matters. On today's episode of Hard Questions, we're going to be interviewing Mars, and he is one of the premier erectile dysfunction techs here in Elizabethtown. Mars, tell us a little bit about yourself.
My name is Mars. I'm your ED tech at E-Town.
Today, we're going to talk about something that a lot of men deal with but don't talk about enough, and that's erectile dysfunction and how it affects our lives. So, my first question is, Mars, at what age do men start seeing erectile dysfunction occur?
Erectile dysfunction typically starts in men in their age 40s.
So, Mars, tell me, why do so many men avoid getting help for this?
Men often feel ashamed, embarrassed, lack of confidence.
Oh, yeah, I understand. And a lot of guys do feel embarrassed. They lack confidence and it just tears them down. So, I want to ask the question simply put, what is erectile dysfunction?
So erectile dysfunction is the inability to maintain an erection firm enough to have sexual intercourse.
So is ED a physical issue or a psychological issue, or is it both?
So it's primarily driven by both. It's metabolic, it could be hormonal, and it could be blood flow. It is both. So we need to address the physical and then the psychological.
So tell me, Mars, what is the first warning signs of getting erectile dysfunction?
So one of the first warning signs is morning wood.
So what I've always heard is that as we get older, losing performance is just a part of aging. Is that right?
Absolutely not. We don't need to lose performance as we age. Many of our patients are in their 70s and 80s and are performing naturally.
So getting morning wood is a real good indicator that things are working properly. So if you're not getting morning wood, does that mean that things could be messed up and not working with your body right? I mean, tell me about that.
Absolutely right. If our bodies are performing well, then yes, we are going to get a morning wood.
So does it have to be every morning?
No, it doesn't have to be every morning, but it's a good indicator that things are performing well.
So tell me, Mars, what is the most common reason for erectile dysfunction that you see in your clinic?
That could be high blood pressure, high cholesterol, and diabetes.
So how much of ED is related to blood flow versus hormones?
It's related to poor blood flow.
So how does testosterone play into erectile dysfunction and sexual performance?
So testosterone helps your libido.
So what does weight gain and poor diet have to do with testosterone?
Weight gain and poor diet raises your cortisol, and it will affect your hormones.
Is ED tied into an early warning sign of any kind that there might be something bigger going on with your health?
So the arteries and blood vessels are much smaller in the penis. So that is the very first one to go, and you need to get your heart checked.
Well, thanks for joining us today, Mars. I really appreciate you answering these questions. And we're going to dive into that deeper next time we come over. Is that all right?
Absolutely. Thanks for having me.